Hi everyone. Okay. So we're going to start today's talk now with EMW Physio TCM and hi. Can you hear me?
Yes.
Fantastic.
Okay. Can you hear me too?
Yes, I can hear you.
Good.
Okay,
Alright.
great. So everybody, today's talk is how TCM can help male fertility. So we covered this talk last week with a Western doctor, Dr. Lee. So we thought that this week we would cover it from a TCM point of view. So we get two different points of view. And so with that, we've invited physician Jasmine. Jasmine, can I just check? Jasmine, are
Hi.
you using Wi-Fi or 4G?
Oh,
Because I keep losing your connection. So might be better to change to 4G just in case.
sure.
Okay, it's 4G now?
Yep.
Great. Okay. So maybe let's have an introduction from Jasmine yourself first, and also introduction about EMW. We've talked to you previously, but it's been a while, so let's refresh our memories.
Okay. So hi everyone. I am physician Jasmine. I'm from EMW, the Gut and Moxa Center. So one unique thing that we do in our clinic is that we actually incorporate traditional moxa into our treatment, on top of what the usual of acupuncture and herbs which I use. And I have also equipped myself to be certified in aromatherapist. So we do also use oils, essential oils, and incorporated into our treatments. Yeah. So a little background of me. I am very interested in TCM because of the language and also the culture, the history. And if not for this, I would have been a Chinese teacher. So then, yeah, after my degree, I actually went on and pursued a 3 years full-time master degree in acupuncture, tuina, and moxibustion. So I'm a very hands-on person. I like to do it, I like to find the very details on the meridians. I like to be very careful and gentle with my treatment so that my patient would actually feel most comfortable despite, having needles. So I try to minimize their phobia of receiving treatments, acupuncture treatments.
Yes, because it can be quite scary. Where is EMW located again?
Okay, so for Gut and Moxa, we are at the Scots Medical Center. So for Scots Medical Center, we have two clinics. One is the Women's Fertility at level 10 and Gut and Moxa at level 12. And we do have one more outlet at Novena. So that one is more on physiotherapy and pain management.
Nice. Okay. So that's the so people who are looking at male fertility, where would they go? Which outlet would they go to?
So you can visit us at the Scots Medical Center at Pacific.
Okay. So the Gut and Moxa one?
Yes, possible, and as well as the women's fertility one. So our physicians are all there. We are equipped to actually help you with fertility issues for both female and male.
Okay. All right. So back to today's topic, okay, of male infertility. I mean, at the end of the day, okay, what is the definition of male infertility? And maybe you can share the statistics in Singapore and this and that.
Okay. So right now, right, I guess infertility is actually for both parts to actually they play their roles in it. So it's actually having the difficulty to conceive naturally. 1 year of protected sex. Yeah. So for male infertility, we are looking at also like the Siemens parameter, as well as like having difficulty to intimacy in terms of ED, erectile dysfunction, or premature ejaculation. So I would always like to remind my patient, especially those who are trying naturally for a while. For men, during our most fertile period, the window, is their most stressful moment to So a lot of time we are actually trying our best to also manage their stress level, their cortisol. Yeah. So
Okay.
because when the stress kicks in, right, a lot of time, 80%, studies have shown that it's a physical, psychological barrier as well. These two are together for men to have difficulty to perform during the women's fertile window. So ladies, try to be also more understanding in that.
Yes.
Yeah, the bonding is really important because once that moment, that sparks is not there, then you will feel it is just to go through the motion. So as much as possible, I think I would always recommend my patients to really enjoy the intimacy and not to just go through the motion lah.
You see, the thing is that when you're trying for a baby, a lot of women probably in their mind is that, okay, the guy just needs to perform. How hard is it to perform? You know, in your mind, you're probably thinking that. But at the end of the day, yes, the thing is that when the guy is stressed, he will be unable to perform. So I guess that kind of goes hand in hand, right?
Yeah. So for the male, for their sperm, important that they have a good shape. That means it's round over in heads. It has long, strong tails to swim. So the quantity and the movement, it matters. So like, for example, I'm going to share a case study, or maybe I'll show you before that, like some of the that would be very common. This is also where we would emphasize on the DNA fragmentation for guys. Yeah, that is where we see like the halo, the head, the shape of the head as well. So I would say for most men, we don't achieve to be like 100% normal sperms, or it's not possible given the environment that we are in, the dietary and lifestyle that we are having. And in fact, the speaker has also shared last week on how WHO standard has actually dropped.
Right.
That's normal.
Not much expectation in men at the end.
Yeah, so they're also working hard lah, huh? The sperms have to work well. So for TCM, we try to actually optimize the body. So to allow the body to prepare itself fully to conceive naturally at its best performance as much as possible. Yeah. So I would say having TCM treatment is better than not having. Yeah. If let's say you believe in holistic measures and treatment. So for example, the next slide actually shows our case study that it's a bit small here. I'm so sorry about that.
It's a bit small.
Yeah, so it's 45 years old male. So after receiving 2 months of TCM treatment, so we are looking at a weekly basis. So depending on the constitution, we actually would advise like the treatment protocol as well as herbs customization for them, tailored to their needs. So the herbs would be possible if, let's say, couples are trying naturally. Once they are into cycles, IVF cycles, then we are slowly looking at purely TCM treatment only.
So no more herbs, basically.
Sorry, again, Kim?
No more herbs, is it?
Yeah, no more herbs. So as to prevent any drugs interactions. Yeah. So for the treatments, right, it's a bit small, but then just want to point out before and after treatment, the most obvious one that we can look at is actually the number of sperms. Yeah, the 3 lines. Yes, comparing before. So the left side shows before, and then the right side shows after. So there would be
basically, so it says here total number of sperms. So the before is 132.3.
32.3. Yeah.
And then after is 142.5.
Yes, correct. And then we want to look at how good they swim. So the motile sperm, even though you can see that there is a decrease.
From 48.95 to 47. So there is almost a 1% drop.
Yes, but if we move up and then we can see on the progressive motility,
Yeah,
that
this one here.
is where we see the improvements from rapid linear, from a 2 to a 6.
Okay, so this one here.
Yeah.
So it's from
So
2,
better
it jumps, they
swimmers
say,
lah.
to a 6.
Mm.
Okay, wow. And
So
so this
yeah,
guy
we do look.
undertook, so this guy undertook the full TCM only for 2 months, is it?
Yes, for 2 months. Yeah.
Interesting.
So we do see improvements in this, but I would say it's not just passively taking TCM treatment. We emphasize a lot on dietary and lifestyle to actually make a change, to let them have some homework to do, you see, like what kind of food that they eat, and then whether they are active and start moving. So all these they play a part in making the person a better person than he is before receiving treatment as well. He is also probably more aware of his own body condition and areas where he can work on.
So basically, okay, let's say when a couple come to you, okay, they
Yeah.
are still trying naturally. They don't know if the male has problems or not. Would you say, okay, maybe you should go for a sperm test, DNA fragmentation? Will you ask them to go for a test? Or, I mean, what would you actually do? Can you tell by not having an actual report?
Okay. So for diagnostic, it's always good to fall back on our Western counterparts, because that's where figures shows the best. They speak for themselves best. You see.
Okay.
What we would normally do when couples first come to our clinic is always to manage their expectation and to find out exactly which phase of the journey that they are in. So if they just started trying not long, say within that 3 months, then I think within that 3 to 6 months we can still try naturally, depending on their menstrual cycle, because for ladies it's much more easier to check.
That's right.
Tracking your ovulation, catching on the fertile window. But for guys, right, it's really the ability to perform, and probably, like, if let's say we want to look at it, it's probably the appearance of your semen as well. So it has to be a bit thick, a white, not too thick, but not too watery as well.
Okay.
So after that 3 to 6 months, if things doesn't work out, depending on age as well, then we would advise them to have a detailed checkup, a fertility test, for both sides, to actually see exactly where we would need more areas to work on, to be more, I would say, focused.
Okay.
So
Interesting.
yeah,
So,
some guys, they may not be very comfortable to do, right?
That's right, yes.
Yeah. But I would always encourage them, doing this test is actually finding out and to have a better standing on where currently your body condition is, so that we can better optimize.
Understand. Yep. Fair enough. Okay. All right.
Yep.
So back to this report. So this is another guy's report, right?
Yeah. So the other guy, he is 36 years old, and then he received 3 months of the TCM treatment. So likewise, if let's say we can recall our lesson learned last week on the, you can read on the comments, right?
Yes.
So on the left, it states there oligotetraspermia.
Yes.
Zoospermia.
And
then the other one, it just states that is tetrazoospermia.
Yeah.
So oligo, we know that is a low sperm count. Okay, then tetra, it means that it's abnormal sperm shape. So we try to we try to improve the condition from having a low sperm count issue to just working on the morphology. Yeah, but there would be also improvements in terms of like the motility. So for this case, we usually would include both A and B. That means the rapid and the slow together, so that we can see on the left as compared to the right. On your right, that would be much more when combined. for both the rapid and the slow.
Yep.
So you have much more in terms of the progressive motility as well. Yeah. So the morphology part, I would say, still have work to be done. So it's not always a how you say linear upwards improvements. There would always be fluctuations. Yeah. So there would be times where morphology may drop a bit, but motility goes up.
Understand.
Ideally, both should goes up together. Yeah. So then when we look at the next results that we have together, there is also the DNA fragmentation.
So this one is it? Yeah.
Yes. That we want more of the large, medium, hollow sizes of the head of the sperm. So we can see that after the treatment, then the large medium is actually significantly, I would say there is improvements to it lah. So then there wouldn't there would be a decrease in terms of the DNA fragmentation.
Okay, understand.
Yeah.
So we don't want it to be.
Yeah. So what we can help to do in terms of TCM treatment, it is to help improve your sperm parameters as much as possible. In terms of morphology, your motility, as well as to decrease the DNA fragmentation. Okay. So having shared the case study, then we would really want to focus more and to know more from a TCM perspective for male fertility that we are looking at today. So the most important one that we always would emphasize is on your kidney essence. So kidney, like the very fundamentals for male. Yeah. So Kim, would you want to guess for women, right? What would be the organ that would be more determining?
Wow, that's a hard one.
Organs, right?
Yeah.
Should we talk together? Okay, we have
I'm very bad. My biology fail, I tell you. But okay.
It's okay. This is concept. This one is concept. Okay.
Yeah.
So
Okay.
I'll tell you lah. I'll give you a cheat lah, huh?
Okay.
Right. We are more emotional, right?
Our heart.
Very close. Very close. The liver.
Liver. Oh, interesting. Okay.
Liver governs emotion in TCM context.
Okay.
Especially for anger.
Wow. So if you're angry, you're hurting your liver, is that right?
Yes, kind of. You can say that. So when we have PMS, right, we kind of can justify lah, huh? Because
so it's not our fault.
It's biological. In moderation. You try to also, manage it as well. So kidney essence is actually a genetic component to say. It comes from the parents. Okay, so this is actually once baby is formed in the mother's womb, this comes together, and then it will only mature at the age of 8 as in start to grow and mature 8 to 16 for males, and then 7 to 14 for ladies. Okay, so there is a saying in TCM context for women to be in the multiples of 7 and for men in the multiples of 8. So having said that, right, TCM has a very different perspective on how optimal you can be during, how fertile and age to it. So for the guys, right, sadly to say, 40 years old. So 5 times 4, 5 times 8. Okay, 5 times 8. That is when aging starts, and then the quality of probably your sperm decreases. Yeah, in TCM context, but it will only stop producing and it starts stapling down at age of 64.
Wow.
Yeah. Interesting, right? So for
Yeah.
women, start
Mm-hmm.
to age at the age of 35. So 5 times
Okay.
7, 35. So it is good that we start to also try to conceive before that.
Mm-hmm.
But of course, with medical advancement and technology, uh, we are able to have it later. But
Yep.
I would say that it is still good to follow the natural rhythm, the
Yes.
biological clock of the body.
Yep.
And if, let's say, age is not, the time is not on our side, then it is more important so for you to actually prepare and optimize your body.
Understand. Understand.
So actually, okay, so other than kidney essence, that,
Yep.
which is the prenatal fundamentals, we
Mm-hmm.
also have spleen and stomach, which is, I would always love to tell my patient, your gut health, your second brain is the most important thing that you can take care and have ownership and discipline on your own. So it's like what you eat is what you are, right?
Yes.
So spleen stomach in TCM context, it helps with digestion, nutrients absorption, and then waste toxin removal. So this part plays a crucial center role to actually transform all your food sources into energy and then nourish your organs.
Okay.
Yes. So if that part is lacking, then I would say, nutrients to the localized reproductive areas will not be very well done. In fact, you probably wouldn't feel good as well because this stomach area, right, is where it holds a lot of like your immunity, your hormone making, the balances, and then how good you feel physically and emotionally as well.
Yep.
So these two works hand in hand. They are very important. We would always look at it when patients comes to us to to find out more about their constitution. So to do treatment to be more targeted at this area. So I have listed down actually on two major symptoms in terms of the performance. So ED and premature ejaculation.
Yep.
I would like to say that most of the time for ED, right, it is actually a deficiency. That means
Okay.
a lack of, a lack of either a good energy. That means kidney, your heart, your spleen, or there is this point number 3, chronic fear. So for organs, we also they have its governance in terms of emotions. So I mentioned earlier on, liver corresponds to like anger, right?
Yep.
So kidney is corresponding to the fear. So if let's
Okay.
say much fear in terms of to perform, even before the fertile window period, you already already have that stage 1, stage 2, stage 3 of that fear coming in, then that would actually affect the kidney function as well.
So interesting.
Yeah.
Okay.
Then for premature ejaculation, usually there would be a excess. That means much more. So we try to bring down all these excess and stagnation as well.
Yeah.
So stagnation, it would be like energy that wouldn't be flowing as well. So there would be maybe like thoughts, a lot of what if moments. Then a lot of plan A, plan B, plan C. You can't stop thinking. Yeah. You can't have restful sleep per se. Yeah. That sorts of behavior lah. So there would be like excess of like heat, fire element in the body. So we try to reduce this by nourishing the fluid as well. So nourishment of fluid, the best it comes from sleep. So that's why we always emphasize, sleep is so important. The time that you sleep, the quality and quantity of sleep, because that is where cellular repair happens, where your rest, your recovery, your regeneration happens.
Interesting. So when so like for example, this premature ejaculation and erectile dysfunction, do you base it on like can you tell by their like and this and that, or do you have to like just like they'll tell you, oh, you know, we face premature ejaculation, then you're like, okay, if you face that, then this is the problems that you face, or how does it work?
Okay, so it really depends on how comfortable the patient they are to actually
Share, right?
correct. But I would say most patients who come in as a couple to work on a fertility issue, they actually they are very open with their sharing.
Okay.
So yeah, in TCM we have our TCM diagnostic 望闻问切. So yeah, 望闻问切, it means that we also try to observe the vibes. So when he or she comes in, right, if the vibe is low energy, sluggish, or the tone that he or she speak is very soft, very slow, this kind of symptoms actually give us an indication whether the person is in excess or in deficiency lah.
Interesting. So when we walk into a TCM center, we have to be careful how we talk, because that's how they know what you're like.
Yeah,
oh, that's very interesting.
Very sensitive to all this. Or you show us your tongue and we feel for your pulse. Yeah, the facial appearance or the color. You know, when people they sleep late most of the time, it's very good vibrant color on their face on.
Yes.
Yeah.
Usually
unless you put makeup lah, then I can't really see and tell. But
understand.
that observation is important.
Yeah, interesting. Okay.
Good to know that it's interesting for you as well.
Yes, for sure.
Yeah. Okay. So for TCM treatment, how we can actually help in EMW is that we actually use very traditional TCM diagnostic and assessment on your body constitution. Right after that, before we head through to treatment, we actually give you very practical dietary and lifestyle advices that you can work on it. Take ownership. So for this, right, we really spend some time, especially for couples with us for the very first time. It is time where you acknowledge that both parties have to work effort and put in that effort lah. Yeah, especially not just relying on passive TCM treatment, but actively what you can do to help, to fasten that kind of optimization and to get yourself prepared. So we have TCM herbs. They are in powdered form. So it's also for convenience. You just have to, mix it with warm water and have it. And I have to emphasize that acupuncture technique is important. So I would say we are really confident as a team of how we actually deliver this out to our patient. Because as much as possible for guys, their pain tolerance level, sadly to say, lower than ladies.
Much lower, much lower.
Yeah, I would say I have a few on hand. They actually love acupuncture because of the exposure, the pleasant exposure that they have. So they kind of look forward to it. So because of this, right, they know that by receiving this treatment, it creates a very positive outcome. So that's why they're like, they can relax, they can calm down, they can even like sleep through during the treatment session. That would be the best, because that would be actually your body innate healing ability taking place.
Okay.
So what we do is actually to give you a push for your body to work and to respond to that treatment.
Okay. Understand.
Okay. Yeah. So like not just improve sperm quality, but we improve sperm quality through reducing stress, improving sleep, improving your gut health in overall aspect lah. So we also do the traditional moxibustion.
What is traditional moxibustion?
Okay, traditional moxibustion, right, is the burning of the mugwort leaf.
Okay.
It's a kind of heat therapy, but with much deeper penetration to your tissue layer. So it's a moving heat energy therapy. Yeah, it's a little bit different from infrared lamps.
Yeah.
Yeah. So this works on point, on surface, that link up, because I would say most of the time for urban dwellers like us, we
Yeah.
always work in aircon environment. We do not move much.
Yeah.
So a lot of stagnant energy. That means energy that isn't moving as well. So I would say in long run, right, we have a deficiency of like the yang energy
Okay.
in the body. So this moxibustion is good to actually help boost the energy level in the body. So what you can do at home is like, for example, for guys, there would be no limits lah. You can time to time have foot bath. Yeah,
Oh,
foot bath,
okay.
it cover above ankle area in warm water. You can put with salt, without salt, that is fine. Okay, so it is just to kickstart of having good routines to keep your circulation warm, moving, vasodilation, and nice.
I see. How often can they do this? Can they do this every day?
I would say no need every day lah, because it's quite an
Okay.
effort.
Yeah,
So
yeah.
in a week's time, maybe 2 times to 3 times would
Okay.
be good.
Okay.
So you can do it
Interesting.
alternate.
Yeah.
Yeah.
Somebody just asking, right? Is it advisable to receive TCM treatment during the window period? I guess this is for both male and female.
Of course. So
Okay.
like for the guys, I mentioned earlier on, some of them, they can be very stressful during that period. So we
Yes.
try to work on reducing that stress level, and also helping them, because when they reduce stress, they can perform better.
Yeah.
Yes. So for the ladies, then we would try to also work on improving blood circulation, blood flow to localize reproductive. So for ladies, we have a treatment, a more tailored plan for the ladies lah, in terms of the follicular phase up to ovulation, and after ovulation to the luteal phase. Yeah. So we work according to the cycle, as well as towards their constitution.
Okay. All right. Sounds good. Okay.
And then, yeah, one thing special in our clinic is that we do acupressure points massage prior to the treatment. So with this, it actually helps the patient to calm down even much more, especially those who are really afraid of needles lah. And also to get their body more prepared. Yeah, it's like warming up the body, a warm up before we actually insert the needles.
Understand. Okay.
Yep.
So this is done before the acupuncture?
Yes, before the acupuncture.
Okay.
Okay, so I just want to like highlight on some studies that have shown, especially like treatments, acupuncture, moxibustion, it actually helps to improve your sperm parameters given time. So I would say 3 to 6 months would be a fair timing for us to actually optimize your body condition. If let's say you have underlying medical issues, for example, hypertension, cholesterol, chronic, then we would really need more time to actually work on cleaning up all these metabolic issues first before we enhance on your reproductive health.
Understand. Interesting.
Okay. Yes. So then we also have the usual reminders. Okay. So we have to really get moving and stop your very sedentary lifestyle, because long hours of sitting down, especially for work, when we sit down, we don't move. And then for the men's, right, your testicles is like always constantly at that position, and then there would be heat that is trapped around it. So there would be stagnant energy in your pelvic area, and then it also may result in digestion and reproductive issues in the long run. So keeping fit, doing moderate intensity exercise, I would say is important. So avoid wearing anything that's tight. Don't place your handphone or laptops on your lap, in your handphone, in your pockets. Yeah. So limit activities that it's heat sensitive, or that may have pressure to the testicles, like cycling.
Yeah.
Yeah,
Somebody was asking about cycling just now. So,
mm,
I mean, like, is just once a week cycling okay? I mean, not too much, right?
okay, so it depends on the sitting pad that you have also.
Yeah.
Yeah, so I would say if there is good cushion to it,
Yes.
once a week plus, probably not over an hour. But
Okay.
I would recommend there are many forms of other exercises. So if this is for the better of your health, take alternatives.
Okay.
Okay,
Don't do
so
cycling. Okay.
point number 5, possible toxin and chemical leach.
Yeah.
Because we always in this environment where pollution is really bad. So as much as possible, I think it's always good to don't tapao so much, don't take away so much. In terms of like the plastic containers, the styrofoam boxes,
Ah,
yeah, I don't think these are healthy. So if you
okay.
can bring containers, if not as much as possible, do your own meals.
Understand. So
Mm,
these outside toxins also may have an effect on basically your lifestyle. I mean, your body and everything as well, right?
correct. I think microplastic issues in body is hard to escape right now. So
Yeah.
it's a lot of time on how strong your immunity is against all this.
Yeah. I guess it's really such a big subject. A lot of people, I mean, they don't quite understand a lot about it, but it is
Mm,
quite interesting, that subject. Yeah.
yeah. Okay. So for your homework, on the dietary and lifestyle, maybe you can pick through on what we usually would actually advise our patient on.
Mm-hmm.
So sleep by 11. And 11, I would say it's the very ideal time, but the cheat for my patient, if let's say you really have work to do, you have your social life to do, latest by 12 midnight
12 midnight. Okay.
in bed.
Not
Okay.
playing
So
phone. In bed
yeah, not
sleeping.
phone play. Yeah, no
Yeah.
no blue rays before you sleep. It's going to interfere on your quality of sleep as well. So the
Yeah.
4 hours, it is mainly for your rest, for cellular repair, for
Mm-hmm.
recovery, and to rejuvenate. When you're sleeping well, not just physically, you feel good. Mentally, emotionally, you feel
Yeah.
you feel optimal and good as well. Especially like the ability to focus, to concentrate, to perform, as well as to feel positive.
Yeah.
Because that is where a lot of like tissue repair, uh, to make hormones. It happens at night. So
Mm.
actually at night when you sleep, right, a lot of things are happening. It's just that we don't know lah. Yeah, we
Yes,
are.
yes, yes.
Mm. And then the other thing is moderate intensity exercise. How much? 2 to 3 times per week if you can commit. If you're
Mm-hmm.
overweight, please try to lose that weight, because
Mm.
we do find that there would be the link, like if let's say in obesity, right, there would
Yes.
be like low testosterone, which is actually very crucial for your sperm production. Mm.
Ah.
It's the same thing like for PCOS, where there
Yeah.
is insulin resistance.
Yeah.
Yeah, so we also want patient to drop the weight so as to balance, or to actually clean to balance up the hormones, the
Understand.
related hormones.
Yeah.
So what you can start doing, brisk walking if jogging is too tedious. So start with a 15 minutes or 20 minutes, something that you can achieve. And
Yeah.
then after that, work on getting it as a routine and habit. So remember just now I said about individuals may have like more thoughts, excessive, like your liver qi stagnation, the
Yeah.
worrisome, must have a lot of plan A to plan Z one.
Yes, yes.
Then we can do more meditation, we can do more
Ah.
yoga, stretches,
Yeah.
something to calm the mind down.
Yeah.
Yeah. So there would always be the flexibility of both the yin and yang spectrum that we can work on.
Yeah. So
Yeah.
I think it's
So
important to know what you are as well first, to know that whether you are yin or yang and everything, and then from there decide what exercise or what kind of lifestyle benefits you the best.
So this
Yeah.
one we would always find out from patients when they are there for the consult as well.
It's such an interesting slide, isn't
So
it?
this chart, right? Wow, this
Yeah.
chart, a lot of information. So why sleep before 11? Okay, so if you look at the 11 to 1
Which is
a.m. around that
yeah.
timing, is where your detox, where cells try to repair, it actually works during the phase where you sleep. So if you sleep late, wake up late, even though you have that quantity of sleep, this part is not going to work. You don't detox as efficiently in the body.
So
Okay?
let's say if you sleep at this time and you still sleep all the way until here, it doesn't count that way, right? It still doesn't count like, oh, I'm getting my 12 hours of sleep, you know, like,
yeah,
no, right?
you mess up with the yin and yang element as well.
Okay.
The natural circadian rhythm cycle. Yeah.
Mm.
So even because in the morning, at night, in the morning to noon time, is the yang dominant energy. We should start moving and work.
Yeah.
So once the energy out will be out from your eyes. Okay. Then you start working, and then when it's time to sleep, the energy goes in at the sole of the feet. Yeah, the yin and yang concept. Yeah, so it actually stores the energy there, and then there is where, you know, all whatever metabolic or detox that is happening during that phase can be carried out nicely.
Wow.
And then the next day, again, energy comes out from the eyes, we start working. So likewise, for people with very difficult bowel, they always say maybe 2-3 days, or maybe 1 week 2 times only, or 1 week time only, whether that is normal.
Yeah.
If you look at the cycle itself, the chart, people with morning bowel, you are doing good, because that is where your lungs and large intestine is. This is where it should have more activity, like to clear your bowel.
Okay.
Yeah, so it's good to know about the energy, where your yang and yin actually have emphasis on, so that you can work on it as well.
Interesting. Such an interesting chart, isn't it? We should definitely share it more. So interesting.
Okay, so dietary wise, I would just keep it very simple. It's actually really fall back on having more healthier food choices, your complex carbo, your lean protein, your healthy fats. Okay, reduce caffeine, alcohol, chili, spicy food, fried or fast food. Then really avoid smoking, cold drinks, raw food, processed items.
Why raw food? Why sashimi as well?
Okay, so cold raw food, right? They are together. These items are not particularly helpful for energy circulation per se. Yeah. Okay, so like raw food, right? We have the microorganism also. So we also want to reduce any cause of food contamination per se in our body. So in terms of optimization of your gut health, and as well as energy circulation, so these are food that I would normally recommend to avoid, especially when you're actively trying. Cheat days, if you would want to have it, I would always advise the ladies, if you really want to have it after when your menses is clean, and then before ovulation, before trying. Okay? Yeah. For guys, if let's say your wife is doing so, then please participate and encourage her. Don't indulge yourself in all this, and then, you know, your wife, she knows that she can't have it. I mean, yeah lah, it's not so nice lah, huh? So do it together.
Okay.
Also limit on the quantity that you should have. Yeah. Okay. So to summarize, in all, I think TCM helps with male fertility, in the sense to actually work on your, not just on your specimen parameters, but also to help you to engage in intimacy better. So to be able to perform better lah. So by keeping to the basic of like just eating well, sleeping early, be active, and happy emotionally, mentally, all these positive vibes would then really help in making things work.
Understand. Okay. So that's it in a nutshell. So it basically comes down a lot to your lifestyle, you know, your thoughts, your mind, your feelings, and this and that. That's pretty much very important as well, right?
Yeah. It's a very holistic
Yeah.
viewpoint that we are always.
Oh,
Mm.
yeah. Okay. Let me just ask you some questions. Okay. Are the same treatments given for all types of men's problems? So if they come to you, you know, for let's say low sperm count, or they come to you for, you know, my sperm doesn't look normal. Do you give them the same type of herbs for all the guys and the same type of moxibustion, same type of acupuncture, pressure points, is it? Or is it, you know,
Mm.
different?
Mm. Okay, I would say the types of treatments, per se, acupuncture, moxibustion, and herbs, they are there to stay because that actually makes TCM unique in that sense.
Yes. Mm-hmm.
But each individual is special. I mean, no two-person would be with the exact same constitution. There would
Yeah.
always be degree of difference, the excess, the deficiency on how much more and how much less.
Mm.
So I would say like point selection,
Yes.
herbs prescription would be different.
Understand.
According to their constitution, based on the diagnosis.
Understand.
Yeah.
In terms of, you know, food types that men can basically take to improve sperm count, quality, and everything, is there any particular food that they should take or
Okay.
diets?
So, yeah. I give you from the TCM perspective first.
Mm.
So, okay, when we say earlier on that you know, guy is highly linked to the kidney function, right?
Yes.
And kidney is also linked to the color black.
Mm.
So anything that is black in color would be helpful. For example, yeah,
Black beans.
black
Sesame,
beans.
okay.
Yeah.
Yeah.
So the black beans, trotter soup, guys,
Okay.
sesame paste. Yeah. What else? Black fungus. Yeah. So all this would be helpful for guys in terms of like to tonify according to the colors, the elements in the TCM chart.
Understand.
From a nutrition perspective, I think
Yeah.
generally they would know that zinc, selenium would be important, especially
Okay.
like for because that is actually found most in the seminal fluid. So oyster would be a good source, but unfortunately, I think with contamination, pollution,
Yeah.
so you can fall back on like poultry, red meat, your nuts, your seeds, walnuts in particular would be helpful.
Okay.
Sunflower seeds, yeah.
Okay.
So Brazil nuts in moderation. So
Okay.
all this would be helpful. Fatty fish, fatty fish in terms of like salmon, yeah, tuna in moderation, sardine, halibut. Yeah, I would normally like to have more of that healthy fats option, olive
Okay.
oil, avocado,
Yeah.
and antioxidant-rich fruits, kiwi, grapefruit. Yeah, so all this would help in terms of like reducing oxidative stress to yourself. Yeah, so eating healthy and eating clean actually helps a lot with a more gentle like digestion for your gut health. Your gut doesn't, you know, take the burden to actually digest unhealthy food per se.
Understand. So, you know, after a man basically goes through the TCM for, let's say, 2 to 3 months, would you ask them to go for another test, or would you say that, okay, by right, it should have improved. You don't need to go for another test. You can go do, try whatever you need to try and this and that.
So it really depends on individual case.
Mm-hmm.
So even though like the earlier on where we share the results, the case study, we do see like there will be fluctuation.
Yes.
Not all standardized that all goes up. We also take into consideration if let's say that 2 to 3 months down the road with treatment, however, unfortunately with like maybe work stress or, you know, family issues, emotionally, physically, you are not feeling optimal. You are still improving. There is that work to be done. So then I won't say that you have to take the test 3 months. 3 months is up, you have to take it. But we actually based on the situation.
Okay.
Of course, if let's say after treatment and then you are feeling positive, you find that your body condition is optimized, you want to do a comparison, then I think that is a fair thing that you can you can actually compare and see how you are right now as compared to before receiving treatment. I think feeling optimal, how you feel, it's much more of an important indicator as compared to just looking at your lab results. Your ability to perform during intimacy, I think all this will be able to tell the signs that whether you are in good shape.
So basically, I mean, it's a feeling, or it's something that you can feel in your body. It's not something that you cannot see. So it is something that you should be able to feel yourself, whether you feel better and this and that. Is that right? Yeah.
Correct.
Interesting. Is there at any point would you say that, oh, so sorry, TCM cannot help you? Okay, you should only go and seek help or medical advice or whatever from a Western doctor, because TCM definitely cannot help you.
Okay. Unfortunately, yes, we do have cases like that.
Okay.
Take a guess.
When they have no sperm?
Bingo! Yes. That means when they have issues like structural issues, varicocele, okay, or azoospermia. That means when they have sperms. Because if let's say things are not working internally already, the structures are there to actually help with natural to conceive naturally, then however much we want to optimize the person's body to focus on fertility issue, that wouldn't be happening lah. So for that issues, we would really recommend them to seek advice from our counterparts, the Western specialists, to have issues fixed, okay, and then come back. Maybe if let's say they are into the IVF cycle, okay, that means maybe have testicular extraction for the sperms, or after the varicocele procedure. Then that is where we can help to prepare and optimize their body.
Understand. So better to get it fixed first, and then we help you kind of later, kind of thing.
Correct. So because TCM is always about your own healing ability to actually be better.
Yes.
Yeah.
Understand. Okay, great. And finally, what is your advice for couples facing, infertility? I'm sure you've seen, with a women's fertility center, you see a lot of couples facing infertility and everything. What is your advice to them?
Okay, so my advice, I would still hold the same as well as what I have given the other time. Because I struggled personally for a while, at least for a year, with my firstborn. So I know that stress is definitely a main big culprit when looking back at how we actually went through the journey together. So two coming as one is important, and then help each other. I mean, ladies, if you know that your husband he needs help during the fertile window period, then try to also get the mood going. Don't have to wait passively to say, how come you can't perform, instead of saying that, be encouraging. So I have very gentlemen, very supportive husband who will also accompany their wife for every single treatment, and also participating in the treatment themselves. So I think it's also a journey where a lot of bonding actually happens if, let's say, two clap together and become stronger.
At the end of the day, it's definitely something, infertility is something that's, you're not alone. It's two persons going through it. So often, I guess as a woman, we feel a lot more, but we probably don't understand that the man is also going through certain feelings that he may not be sharing as well. So it's good to have talks with your husband and see what he's feeling, and if at the end of the day, sometimes men are not good at sharing, then I mean, at least you tried at the end of the day.
That's right. All right.
So thank you so much, yes, for your time again today. You know, we were
Yeah,
talking to you
yeah,
soon, but thank you. I think that you've given definitely a good overview for the TCM part of it. You know, we have a very good overview last week from the Western doctor and now from the TCM point of view that I think we've kind of covered male fertility in a good way already. And,
yes.
you know, if you need more information, you know, you can contact EMW and they will, you know, tell you where to go, I mean, who to see and this and that. They have 3 different centers and they can provide you with the right advice that you need. So with that, thank you very much. Thank you, Jasmine, for your time. And we will see
Okay.
you guys soon again. Thank you so much. Good night, everybody, and have a great weekend. Thanks,
Okay.
Jasmine. Bye. Bye.